Hello students, today we are going to revise the topic dissociative disorder. So what is dissociative disorder? You all must be thinking. So dissociative disorder are a mental disorder that involves experiencing a disconnection and lack of continuity between thoughts, memories, your surroundings, action, and identity. People who is suffering with this dissociative disorder, they feel that they have escaped from the reality in way that are involuntary and unhealthy and cause problem with functioning in everyday life. So the dissociative disorder is a mental disorder that involves experiencing a disconnection between the continuity of your thoughts, memories, surroundings, action, and your identity. So let's just start with a slide. Once we start with a slide, I'm going to give you an overview. So what is dissociation? Dissociation is a period when we feel disconnected, as I told you earlier, disconnected from the environment and or from ourselves. We all have this moment of disconnection from time to time, daydreaming while driving or switching off and missing part of a conversation, right? So for example, these moments of not being with it normally pass quickly. So sometimes someone with a dissociative disorder has persistent and repeated episodes of dissociation that are extreme enough to severely affect your everyday life. It means if this dissociation or disconnection is happening with you for a few times or sometimes, right? So it is considering as a normal. But if it is continuing and repeatedly you are having an episode of disconnection, then you need to have a help. You need to consult a doctor. As I told you, it is a mental disorders, right? Usually this dissociation disorders develops as a reaction to any trauma and help keep difficult memories at your bay. Symptoms sometimes it's ranging from amnesia to alter identities and depends on the part or on the type, right, dissociative disorder you have. So according to that your symptoms may be vary. So time of stress can temporarily worsen symptoms and make them more obvious, right? So let's see the definition of dissociative disorder. Dissociation is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. Dissociative disorders include dissociative amnesia, dissociative hope, depersonalization disorder, and dissociative identity disorder. So I'm going to discuss this all in details later on. People who experience a traumatic event will often have some degree of dissociation during the event itself or in the following hours, days, or weeks. Like for example, the event seems unreal or the person feels detached from what's going on around them as if watching the event on television. So, what is the cause of dissociative disorder? Why you feel that disconnection, you are feeling the disconnection from the reality or memories or identity? So, what are the causes for that? So, usually dissociative disorders develops as a way to cope with the trauma. Whenever you are going through any trauma, so this way you can cope up with the situation. The disorder most often form in children subjected to long-term physical or sexual or emotional abuse, or less often a home environment that's frightening or highly unpredictable. The stress of war or natural disaster also can bring on dissociative disorder. So if you are having any abuse, like it is physical, sexual or emotional, or if you are going through any trauma, or you have some environmental problem, or you're feeling like is there any natural calamities or war situation, so in that you feel that you have disconnected yourself from the reality. Personal identity is still forming during childhood, so a child is more able than an adult to step outside of himself or herself and about trauma as thought it's happening to a different person. A child who learns to dissociate in order to endure a traumatic experience may use this coping mechanism in response to stressful situations throughout the life. Now, what are the risk factors? Who all are at high risk? So, people who are experiencing long-term physical, sexual, or emotional abuse during childhood are at greater risk of developing dissociative disorder, as we discussed in the causes. And children and adults who experience their traumatic events such as war, natural disaster, kidnapping, torture, or extended traumatic experience, early life medical procedure also may develop this condition. So this all people are at high risk of dissociative disorder. Now, what are the symptoms dissociative disorder have? So, depends on type of dissociative disorder you have. This may include memory loss, amnesia of certain time period, event, people, and personal information, a sense of being detached from yourself and your emotions, a perception of the people and things around you as distorted and unreal, a blurred sense of identity, significant stress or problems in your relationship, work, or other important areas of your life, inability to cope well with emotional or professional stress, mental health problems such as depression, anxiety, and suicidal thoughts and behaviors. So these are the signs and symptoms of dissociative disorder. Now let's discuss the 4 types of dissociative disorder. Or there are 3 major dissociative disorder defined in the Diagnostic Statistical Manual of Mental Disorders, which we call DSM-5. So first is dissociative amnesia. What is dissociative amnesia? In this, so dissociative amnesia is when a person can't remember the details of traumatic or stressful events, although they do realize they are experiencing memory loss. This is also known as psychogenic amnesia, right? Dissociative amnesia is also known as psychogenic amnesia, and this type of amnesia can last from a few days to 1 or more years. Dissociative amnesia may be linked to other disorders such as anxiety disorder. Right? So, and under that also we have 4 categories: localized amnesia, selective amnesia, generalized amnesia, and systematic amnesia. So what happens in localized amnesia? For a time, the person has no memory of the traumatic event at all. Like for example, following an assault, a person with localized amnesia may not recall any details for a few days. That is called localized amnesia. In selective amnesia, what happens? Person has patchy or incomplete memories of the traumatic event. In generalized amnesia, person has trouble remembering the details of their entire life. And in systemized amnesia or systematic amnesia, person may have a very particular and specific memory loss. For example, we can take, they may have no recollection of one relative. So these are the type of dissociative amnesia, or we can say the category. So I have just given you a brief introduction. Now we are moving towards again slide. So dissociative amnesia, the main symptoms is memory loss, that more severe than normal forgetfulness, and that can't be explained by a medical condition. You can't recall information about yourself or event and people in your life, especially for a traumatic time. Dissociative amnesia can be specific to event in a certain time, such as intense combat, or more rarely can involve complete loss of memory about yourself. It may sometimes involve travel or confused wandering away from your life. An episode of amnesia usually occurs suddenly and may last minutes or rarely months or years, as I told you earlier. So hope dissociative amnesia is clear. Now we are moving towards dissociative identity disorder. So what is dissociative identity disorder? In this, what happens? This is the most controversial form of dissociative disorder, which is called dissociative identity disorder, and is the most controversial of the dissociative disorder, and is disputed and debated among mental health professionals, right? So previously it is called multi-personality disorder, and this is the most severe kind of dissociative disorder. Before it was called a multiple personality disorder. So formally, here also in slide I have mentioned that formally known as multiple personality disorder, this disorder is characterized by switching to alternate identities. You may feel that presence of 2 or more people talking or living inside your head, and you may feel as though you are possessed by other identities. Each identity may have a unique name, personal history, and characteristics, including obvious difference in voice, gender, mannerism, and even such physical qualities as the need for eyeglasses. There also are difference in how familiar each identity is with the others. So people with dissociative identity disorder typically also have dissociative amnesia and often have dissociative growth. Next is depersonalization, derealization disorder. So what happens in this? Depersonalization disorder, it is characterized by feeling detached from one's life, thought, and feeling. Right? So people with this type of disorder say they feel distant and emotionally unconnected to themselves, as if they are watching a character in a boring movie. Like other typical symptoms include problems with concentration and memory. So the person may report feeling space or time of control. Time may be slowed down. They may perceive their body to be different shape or size than usual. In severe cases, they cannot recognize themselves in a mirror. So this is depersonalization or derealization disorder. So this involves an ongoing or episodic sense of detachment or being outside yourself, observing your actions, feeling, thoughts, and self from a distance as through watching a movie. Other people and things around you may feel detached and foggy or dream-like. Time may be slowed down, as I told you earlier, or spaced up. And the world may seem unreal. You may experience depersonalization, derealization, or both. Symptoms which can be profoundly distressing may last only few moments or come and go over many years. And the last one is dissociative hope. It is also known as psychogenic hope. The person suddenly and without any warning can't remember who they are and has no memory of their past. They don't realize they are experiencing memory loss and may invent a new identity. So typically the person travels from home sometimes over thousands of kilometers wide in the fugue, which may last between hours and months. When the person comes out of their dissociative fugue, they are usually confused with no recollection of the new life they have made for themselves. So hope you understand dissociative fugue. If not, then I'm again repeating. So dissociative fugue is a psychological state in which a person loses awareness of their identity or other important autobiographical information about them, and also engage in some form of unexpected travel and in different places. Now, what are the complications of dissociative disorder? So the first one is self-harm or mutilation, suicidal thoughts and behavior, sexual dysfunction, alcoholism and drug use disorder, depression and anxiety disorder, post-traumatic stress disorder is very common, personality disorder, sleep disorder including nightmares, insomnia and sleepwalking, eating disorder, physical symptoms such as light headache and non-epileptic seizures, major difficulties in personal relationship and at work. So these are the complications you may feel if you are suffering with dissociative disorder. Now, how we can find out? What are the diagnostic measures? So if you are concerned that you or a loved one may have dissociative disorder, it is important to seek the professional help, right? Dissociative disorder always requires professional diagnosis and care. So diagnosis can be tricky because dissociative disorder are complex and their symptoms are common to a number of other conditions, right? For example, physical causes such as head trauma or brain tumors can cause amnesia and other cognitive problems. Mental illness such as obsessive compulsive disorder, panic disorder, and post-traumatic stress disorder may cause similar symptoms to dissociative disorder. The effect of certain substance including some recreational drug and prescription medications can mimic symptoms, and diagnosis may be further hampered with a dissociative disorder coexist with another mental health problem such as depression. So we need to follow DSM-5 classification for diagnostic measures. Now, how we can prevent this dissociative disorder, right? So children who are physically, emotionally or sexually abused are at increased risk of developing mental health disorder such as dissociative disorder if stress or other personal issues are affecting the way you treat your child seeks help. Talk to a trusted person such as friend, your doctor or leader in your faith community. Ask for help locating resources such as parenting support group and family therapist. You can look for a church or community educational program that offer parenting classes that also may help you to learn a healthier parenting style. And if your child has been abused or has experienced another traumatic event, see a doctor immediately, and your doctor can refer to a mental health professional who can help your child recover and adopt healthy coping skills. So this way you can prevent dissociative disorder. Now let's talk about treatment and management. So the effectiveness of treatment for dissociative disorders has not been studied till now. Treatment options are based on the case studies, and generally, so we can give a symptomatic treatment for this, right? Safe environment we can provide. So doctor will try to get the person to feel safe and relaxed, which is enough to trigger memory recall. In some people with dissociative disorder, psychiatric drugs such as barbiturate we can administer. Hypnosis therapy we can use may help to recover repressed memories, although this form of treatment for dissociative disorder is considered controversial. Psychotherapy we can use, which is called talk therapy, or counseling, which is usually needed for the long term. Examples include cognitive therapy and psychoanalysis. Stress management, since stress can trigger symptoms. Treatment for the other disorders, like typically a person with dissociative disorder may have other mental health problems such as depression or anxiety. So treatment may include antidepressants and anti-anxiety medications to try to improve the symptoms of the dissociative disorder. I hope everyone understood what is dissociative disorder. Thank you so much for listening.